Today, Emir Bey will be sharing with you their lean transformation journey since 4 years. Yeah, it's your turn.
Thank you, thank you, Ilke. And so I'm very sorry for the 5-minute delay because we had a connection problem, but now at last we are here. And I want to share our experience of developing teams and daily management in our hospital. Let me introduce myself. I have 15 years of healthcare management experience, now acting as general manager of Hisar Hospital. My background is electrical and electronics engineering and biomedical engineering, and I'm making my PhD on health management, and I'm working in the hospital since 2010. And when did I meet with Lean is 2018. Our life has been started to really change. We are in a really change and transformation. Because we lost 5 minutes, I want to speed up, and I will be faster. Now, the presentation content is some information about our hospital, and then the summary of our lean transformation and how we are going with developing teams and daily management. And we will share our lean house and how we will shape our future. It will be our content of lean management. Our hospital is serving since 2005, and it has 212 beds with a smart building technology. The area is big, so 30,000 square meter areas. We are serving with 54 medical departments with 850 employees. 120 of them is physician with 7 operating rooms. So you can see that applying lean it's not a very small organization. It's a quite large organization. So we are trying to apply lean all. And the hospital is accredited with Joint Commission International since 2006, which is in the first year of opening. We had 5 successful surveys in our quality journey. Joint Commission, thanks to Joint Commission International, that helps our quality journey. And thankfully, we had our last survey without any finding. So this slide is because of we are connecting lean with Joint Commission and quality rules and patient safety. So lean really helps us a lot in making Joint Commission international and quality applications. The latest technologies have been used in the hospital, MRI, CT, and we are giving a lot of importance to human care, and we are using low-flow anesthesia equipments that decrease to the anesthetic agent to 15%, which is a principle of lean, put the patient first. So we are putting the patient first to get low doses. And this is our other hospital, Hisar Hospital Çamlıca. It's serving with 20 beds. There also, we are using our lean applications also there. And this is our next project, Comprehensive Cancer Center project. The drawings you can see. We are using lean designs in this project with value stream mappings are done, spaghetti diagrams have been drew in the design stage. So our aim is to share 1-point complete service in cancer. And this is our future projects, a new hospital, again, a lean hospital in 2025. So let's start with our journey, how it started. In 2018, our mentor is our chairman. So we are very lucky hospital. Mr. İsa Ateş is our chairman. He is industrial engineer, and he has some consultancy background. So we decided to combine safety, quality with lean in 2018, and starting reading the first books, Beyond Heroes and Lean Hospital books, by the executive board. First, executive board should be educated. This is a reality for us after 4 years. So we started with reading the Lean Hospital and Beyond Heroes books and made small analysis. And then 2019 is our full education and application year, it was our education and application year. We were educated by Lean Institute Turkey, and then managers, directors, managers, team leaders have been educated. After that, our employees starting to be educated, and continuous training was done, and value stream mapping, problem solving was started to apply. 2020 was our pandemic. COVID-19 pandemic was there, and what Lean says is every problem is an opportunity. So we used Lean approach fighting with COVID, and also we used this year for educating our people in COVID-19. And we started our Sensei training programs in late of 2020. 2025 was a better year for us because we learned a lot from Lean, and we started also thanks to Ms. Ülkü Kulaç. She started to our consulting, active consulting with Lean Institute, and we started to work with her. We started working with her, and we are very happy by their helps here. And we started also Hisar Asakai meetings. That's what we call the stand-up short meetings is called in our hospital. Hisar Asakai meetings started. This year was much more on Kaizens and standardization of Lean journey, and we are going to vision. Ms. Ülkü, just everything is working, right? You can hear me and you can see the screens, right?
Yes, it's all right. Yeah.
Okay, thank you so much. And now, how we approach to the team development is, it's again our Lean house in our Lean hospital. We on the right column it's the employees, and on the left column processes. On the bottom, foundation, standardization, and Kaizens, and in the middle is the leadership, and on the roof is quality, safety, patients, 360-degree service. So my presentation will be in 5 steps, and the first content is the employees. So this is an example of our trainings. This was the first trainings that we met with Lean. Directors, managers, team leaders, and were trained. The training content was what Lean is, Lean leadership, value stream mapping, problem solving, PDCA methods, and we learned and we really applied it in the groups. This was the first project group of the executive board. It's a very good history for us, and these are the books that every team leader has read these books. The Lean Hospital, Being Heroes, and the Toyota Way books have been read and also presented to the board, because reading is not enough. When you present something, that we understand that it is understood. And we try to find out how will we teach value stream mapping on the field, because value stream mapping, is not an easy tool. So we started to make videos. The tool of visual management of Lean. We started we had a pilot project in our laboratory, and we combined the field, the HIMS system, and the value stream mapping process. So our team leaders, which we'll call them sensei, they understood how the value flow mapping will be done and how value flow mapping is taught. So as you can see, the samples are received first, and this is the real life. And on the right side, you can see the step of value stream mapping, IS, TS, and Q. And at the same time, we can show the HIMS system that each value stream mapping is running, how it runs in HIMS and how it can be followed up. And I will not take you long for all the whole video because we have a very limited time. So this was a very helpful approach to understand and educate and teach about value flow mapping, value stream mapping technique. And also this is an example how we understood and how we educated about 5S trainings in laboratory, in operating room. This was our pilot projects, and then we spread these methods to all over the hospital. You can see many waste has been get rid of. We get rid of many waste in the laboratory, some refrigerators, some computers, and also in the operating room we changed many things. And also it was with the help of Mr. Kukulac also. She guided us in these projects, and we changed the positions, the cables, tools, and everyone. So 5S has been learned by these ways in the hospital. So second column is the processes. We need very, very good processes, very flowing process in the hospital, because you know, in a hospital environment, the patient is not visiting only one place. The patients need service from many different departments. So the processes should be flowing very well. So we care on value stream mapping because of this reality a lot. We make use of value stream mapping, and each and every department, every team leader, and most of our staff has learned value stream mapping. As you can see in the operating room, in the emergency service, hematology department, emergency, transferring patients from emergency to intensive care, angiography patients, cath lab patients, outpatient billing services, international patients, so the purchasing department. So we used value stream mapping tool in all departments. And in the important and critical flows, we were making deep analysis like spaghetti diagrams, because the layout, we found that the layout was not very efficient in the hospital, and the root cause, but after the root cause analysis, we saw that the layout should be better. So we made deep analysis. We used spaghetti diagrams, and we have checked the flow of the patient, nurse, doctor, and etc. So, and also we made hygiene analysis on these issues also for the layout, for the place of the department in the hospital. And you know, in the hospital, the intensity is not stable. The load is not balanced very well, because on Monday it's different, and on Wednesdays it's different, on Saturday it's different. The load of the patient, the need of the patient, day and night, it changed a lot. And also, for example, this is winter is coming in Turkey, and the load in pediatrics department and the other departments are not the same. So we made a capacity analysis by each department each day. And also, it was not enough. We made also benchmarks after every analysis, before decision making. We have reviewed the competitors and international benchmark. And a very simple and a very proud of project is our. After this analysis, this is just an example. Our preoperative anesthesia clinic, the patient was going to the examination and the blood drawing and ECG and other services. We combined all of them in one point, complete service, and we made 75% process improvement in the eye of the patient. And after all these analysis, that was not only this project. We expanded some of the polyclinics. We changed the place of the management in our management. Our management offices were changed because we were standing in a very critical place in the hospital. So our chest disease departments replaced us, and etc. I will pass these examples, not to run out of time. And the third part is the teamwork and the leadership part. And I want to also emphasize the importance of Hisar Asakai meetings, short daily stand-up meetings. We started in 2021, and it changed our life a lot. So every morning at 7:50 to 8 a.m., our patient counselors, admitters, nurses, technicians, and team leaders, they come together in the hospital and they make the first meeting. After that, the second meetings with team leaders and the managers, and the third meetings with managers and directors. This was just the start, and you can see the pictures. We made pilot application in the patient service departments. Once it's standardized, then we spread to all of the departments. And you can see we developed documents to get notes of the problems of the targets or in the Asakai meetings, and then we spread to the field. Well, I want to speak about these meetings by 2 minutes. When we started, the lean transformation is not done in a complete way in an organization. Mostly lean transformation is done in one department. The lean tools are done in all aspects and then spread to another department. But in the hospital, it's not easy because the patient physically goes from one department to another department, receives service from patient services, nurses, physicians, laboratory radiology, and etc. So everyone should develop. And this daily stand-up meetings, Asakai meetings, was a very effective tool. It was not easy. Thanks to our lean office and quality office, they gave great effort, and also thanks to our team leaders and managers. And they created an environment that people can freely talk about the problems first. So it was a very critical issue. And then we started to see the problems better in the hospital. And now we see that we can speak about the problems very good, and we need to improve. And improving is by putting the visual management, putting the KPIs, putting the targets in quality, safety, cost, and speed. And we need to be better in problem solving. And now we are focused on how we can, how every hierarchy solve their own problems, and we are working on it a lot. So this was a very good and very hard but very effective way of lean transformation. And another example of the teamwork is the interdepartmental management. And as you see, the patient, as I said, gets the service from many different departments, and the patient flow should be without waste. And we got the idea from Toyota. We increased the number of our leaders, team leaders, and they made this flow better. And also by learning and applying the lean principles, they became sensei. So the lean transformation became easier, and the patient flow, we could see the problems in every area, and these team leaders started to highlight the problems and solve the problems. And after the coordination stage, I want to show you the end-on system. I will show you the end-on system first. Oh, okay, it's not there. So I will come to end-ons after it. The fourth phase, the foundation, is standardization, 5S, visual management, continuous improvement, and Kaizens. To apply lean, our lean office created some forms on problem solving and value stream mapping, and we standardized how we will approach the problem, how we will track a problem, and how we will standardize the documents. And again, you can see the visual management here.
Timeout işlemi nasıl yapılır?
Again, a standardization tool is a visual management for us. This is prepared for the physicians and nurses and the operating room staff. And so timeout is a very important part of the incision of the operation. So standardization is done also by these videos. So Kaizens, this year we were very proud of our Kaizens. Now, after Asakai meetings, after daily stand-up meetings, people started to see the problems. Our staff started to see the problems. And after they see the problems, they started to solve the problems. And we created an environment to, our lean office created an environment to them to present their Kaizens. And we decided to make a competition for it. And in April was our first competition. Let me show you the video of the competition. Of 96 Kaizens were filtered by 10, and on live in our conference room, all the hospital was there, and the Kaizens were voted. And this is the last 10 seconds of our Kaizen project. Kaizen competition, sorry. So it's a very important part of Hoshin Kanri, and people gave importance. Here you can see our chairman, Mr. Isa Atesh. He is our leader for this lean transformation, and this was the first group. This was the winner group of the Kaizen, and you can see all the hospital was there, and everyone could feel this culture very well. And Endons, once we saw the patient flow, this is another tool we are using for more than 1 year. We saw that in the polyclinics, in the blood drawing, in the radiology, we saw waiting waste. So we made systemic analysis, and then in our HIMS system, we prepared a system that we can see the waiting patient in each and every department. So when there is a load, there is an unbalanced load, the team leader goes directly there and makes improvements. So once we learn a problem there, then we approach it to how can we continuously solve this problem. This is the unknown screens that we are using. And lastly, our quality. In the roof, there's the quality, and here you can see our 360 degrees quality approach. We have to give the best service to our first patients, any of our patients, and each patients with one of our employees, any of our employees, and each of our employees in the first time and on time and every time. Lean is helping a lot to achieve these goals. I'm running out of time, I know, but I want to share also this strategic plan we made with Lean Institute with Mr. Kuklac. And now,
Emir Bey, you may have 3 minutes more.
Okay. Thank you, Mr. And this is our final part, looking into the future. Now, we learned a lot in these 4 years in our journey, Lean transformation journey, and now we made a Lean strategic plan. The plan includes, so we could separate daily management, interdepartmental management, and strategic management, and each management style is assigned with the titles of the staff, and we defined which Lean tools should be learned very well. This is the first 6 months, this is the second 6 months, and the next year, and the next year. So in the basic level, medium level, and the advanced level, which tool should be used in which level. And for example, in the interdepartmental management, we used to which tools should we learn it. For example, value stream mapping, KPI, and visual management, A3, Gemba should be done in this level. And the strategic management is responsible much more from the Hoshin Kanri and the leadership. And also we defined which books should be read and with the lean principles and the generations, the first yellow belts, green belts, and black belts, this will be given to the succeeders there. And we made a training schedule, and the staff, team leaders, responsible managers, and directors should be getting these lean tools, because we are having a culture now with the daily meetings, with the problem solving, with the Kaizen, so we can use these tools in our environment now. We are ready in the next 4 years. We are ready to apply these lean tools. And our team leaders as Toyota does, our team leaders are the most important people in our lean transformation. So we will also develop our mentors. So how will we do it? First, it's a personal development plan will be done to the mentors, and the basic trainings will be given, and then they will make a Kaizen with a mentor, and then makes 2 projects without support, and they will lead the second project without support, give training, and they will be mentoring on the relevant subject. Our aim is to create mentors in each and every department, and they will be the team leaders. And here, how they will learn the lean tools. They will start with the daily meetings and Kaizen and the dashboard, standards, 5S, spaghetti diagrams, PDCA, and then A3, Pokayoke, Andon, Genban, etc. And then finally, they will need to learn Hoshin Kanri, the pull systems, and the budgets, and the leadership. So this is our future plan, and we will measure their competence level by these diagrams. And this is my presentation, Ms. Ülkü. So if any questions, I will be happy to share.
Thank you very much, Emir Bey. You shared a very interesting journey, especially in terms of always benchmarking for every decision, and also some unique points of your case. One is you need to deploy first before deepen the implementation in the pilot areas due to special conditions of the hospital, and also it's not very common in Turkey a hospital led by engineering backgrounded people. It's also your unique case. I'm checking one good comment comes in. As I understand it, the main reason behind your success is management support. So maybe you need to comment on this or emphasize this point a little bit more.
You know, this the hospital healthcare organization is not an easy way to transform. So as management, we should be our decisions should be done stable, and we should support our staff and our employees. So our chairman gave us this courage to apply lean, because when you apply lean, you have to be patient, you have to be tolerant to the problems, and etc. And we gave great support to our staff, but also we have a very in our hospital, our staff is really taking care of development. We supported them, but they also decided to apply lean, learn lean, and they are happily applying lean, understanding lean, and they're helping us a lot. So we are putting the patient first, and our staff is also, our environment and our staff is also very keen on this approach. And I want to also thank to our managers, to our team leaders, and our staff on this journey also.
Thank you so much, Emir Bey, and thank you for all the audiences. Have a nice day. Bye-bye.
Nice day. Bye-bye.